Hello, and welcome to What Does Low Health Literacy Look Like? Part 2 of the Bellac Library's Health Literacy Workshop. If you remember from the introduction video, only 12% of American adults rated a proficient health literacy level at the last national assessment. And in that last video, we also reviewed the consequences of low health literacy. Clearly, health literacy is a concern in this country. But let's dive a little deeper into what health literacy means by looking at just how complex healthcare can be for a patient or client. Let's say a patient receives a new prescription at their most recent primary care visit. Now what? Well, they have to find the pharmacy to pick it up. They have to discuss any questions with the pharmacist and sign a form. Now, when they get it home, they have to read the label so that they know what it is and can differentiate it from any other medications they take. They then have to follow the directions for use, time of day, frequency, with food, without food, and so on. Then they have to remember to take the medication. Is it complex enough to require setting a timer or alarm or setting up some other system? And finally, now that they've done all that, does the medication have side effects? Do they know what they are and when those might be serious enough to seek help? Now let's look at it from the prescriber's point of view. If you were the prescriber, are you confident you were able to communicate all of that so that your patient or client can be successful? It feels like there are a million potential stumbling blocks at every point along that path. Now, what if the patient has low health literacy? How would you know? Can you tell just by looking at someone whether they are health literate or not? Let's say you even have additional information from their intake forms. David, on the left side, is 23 years old. He grew up on the North Shore and now lives in Malden. He completed high school but did not go to college. English is his first language. He is in excellent physical health and plays in a kickball league. Maria, on the right side, is 34 years old. She immigrated to Boston from Spain about 8 years ago. English is her second language, but she is a very proficient speaker. She obtained a master's in business administration from Harvard. Maria is in good physical health, but she smokes cigarettes. Can you tell which of these two is more likely to be successful in carrying out healthcare activities? The simple answer is no. There are validated health literacy assessment tools, but using them with every client isn't always practical. In addition, they tend to be very activity-specific. For example, one of the tools asks people to read and interpret a nutrition label. Even if a person did that successfully, does that mean they'll be able to do any other healthcare activity just as successfully? It's unclear whether results of those assessments let you generalize like that. So let's look at the factors that influence low health literacy. In the previous video, we summarized some of them, but now we're going to dig a little deeper. Health literacy is strongly linked with general literacy and numeracy, all those things you see on this list. Similarly, it can be strongly correlated with educational attainment as well. Of course, educational factors do not sit in a vacuum, and education, as well as health literacy, are influenced by societal factors like these: politics, economics, demographics, culture. Both educational attainment and some parts of these societal factors you may be able to discern from intake forms or health records. But even if you can, are you able to confidently say that everyone in any one category has the same health literacy level? Some of the reasons you cannot be confident rests with a third group of influences, and these ones certainly won't appear on any intake forms I've ever seen. These are situational factors. These factors can be largely invisible, but still have an enormous impact of the health literacy of the person sitting in your exam room at that exact moment. They can be long-standing, something that happened that morning, or something that happened during their interaction with you. Okay, so we've been focusing on the patient or client perspective, but way back at the beginning of the previous video, I was encouraging you to think about your own role. So what are some of the ways you influence the health literacy level of your patients and clients? Well, it's things like jargon, all those technical terms your friends and family don't understand. Incomplete or imprecise information, leaving out details, like telling someone to do something, take a medication, perform an exercise twice a day, but not how far apart those times should be. Or it could be not providing context. Why is this important? It could be too much information, overloading them with details so that they don't know which ones are actually the important ones, the ones that need their attention. It's certainly the complexity of our healthcare system in general, and how well you, as a clinician, can help them navigate it. Do they know how to take the next steps they need for their care? And finally, it could be ignoring cultural influences. Doing that can make a client feel like they're being challenged or dismissed on who they are as a person. All of these factors can take practice to even notice, and certainly take planning in order to avoid the pitfalls. At this point, we've gone over influences on health literacy from both the patient and clinician perspectives. Have we gotten any closer to answering the question in the title of this video? Do we know what low health literacy looks like? I'm hopeful you're coming to the same conclusion I have. Low health literacy looks like all of us at any given moment, which is why you need to learn approaches that can help you work with people at all health literacy levels. And the first place to start is by taking universal precautions. But what does that mean? According to the Agency for Healthcare Research and Quality, it means assuming all patients are at a risk for low health literacy. If you can't recognize low health literacy by looking at a person or even taking a history, this is the only responsible approach. Just as clinicians don gloves anytime blood may be present without first trying to ascertain whether someone has a blood-borne pathogen, you can take universal precautions for health literacy. And in the next two videos, we'll provide information and techniques you can use in this approach. So that's it for this video. Please get in touch with your Belloc librarians if you have any questions.